Well, let's talk a little bit about a phenomenon. It's not even a phenomenon, but let's make it attractive and fun.
Okay.
Corporate dentistry.
Okay. Yeah.
I'm
Yeah.
noticing a
That'll make
big.
me cry too.
Oh, no, please don't.
Hi, I'm Natasha Gillis, and here's a little secret. One of my favorite things to do is drive around town and proudly point out each dental practice my firm has helped grow. Because behind every practice is a real story of grit, vision, and entrepreneurship. On this podcast, you'll hear those real stories straight from the dentists who dared to build something of their own. So tune in, get inspired, and remember, your practice is my passion.
So let's talk a little bit about who are you? Tell us a little bit about your background, because I really want to dive into the family dentistry component. Teaser alert, because I know a little bit about that.
Okay.
But you come from a family of dentists, which is kind of unique these days.
It is. I'm a native Northern Virginian. I was born and raised in Fairfax. Went to Robinson High School in Fairfax, went to JMU, and then went to MCV down in Richmond. So I've always lived in Virginia,
MCV is now
which is now the VCU School of Dentistry.
VCU. That's
Okay.
incredible.
And so my father was a dentist. He started the practice in 1966 in the basement of our home,
Really?
right on Braddock Road.
That was your old home?
So it was right up the street. It was a block up the street on the other side of Braddock Road. So Braddock Road is the dividing line between Fairfax and Burke.
Yes.
So he started the practice in Fairfax, and then in we believe it was 1974, moved across the street, bought the house across the street, added the office on, and moved the office over there in 1974.
That's incredible.
Yeah.
So how old were you when you started coming into the office?
No. I mean, again, it was in the basement. I remember playing in the backyard, and they had one of those, my father had one of those well windows in the basement because the practice was in the basement. I'd stick my head in the well window, look into the basement where he was working on patients.
That's awesome.
Yeah, that was from one of my first memories.
Did you ever have a conversation with your family about, do you want to follow in your dad's footsteps, or was it kind of a natural, hey, he's a dentist, I'm going to be a dentist?
Had no desire to be a dentist.
So how did this happen?
Absolutely. I was in college. I was at JMU. I was a biology major. And I was deciding which way to go between medicine and dentistry. And after really looking into how long it would take for me to be a physician, I took the easy way out and went to dentistry because I had a job waiting for me when I got out.
That's awesome. And your brother's a physician.
He is a physician. He didn't want to he actually was an engineer and then went to medical school. So he had my dad always thought that he would follow in his footsteps, but he had no desire.
The black sheep.
Well, so when we were younger and my dad would have an emergency, he would take one of us, typically our older brother, down to the office with him, and he would have to assist. And so as a young kid, he's sitting there assisting my father on a weekend. Dentistry can be a little gross at times, especially when you have a real bad infection. So he grew up with that, and I think that turned him off.
Ooh, yeah, I can see that.
Yeah.
I'll scroll through IG and I'll see some of those cases and I'm like, whoa, I
Yes.
saw a little too much here.
Yes.
So you became a dentist, and then what?
So I joined the practice in 92.
92.
And then my father and I practiced together, full-time together for about 5 years. And then he cut back to part-time. And then he practiced up until, I think it was about 2016
Wow.
is when he finally retired completely. And that's when I went solo at that point.
So that's interesting. Your path was pretty much defined as dental school. I mean, you went straight through. You went all the way
Yes.
through, and then you went right into dentistry. You started working with your dad.
At the time, there wasn't the requirement to do any type of shadowing. You didn't need hours in the dental office. You could go straight from undergrad to dental school. And at the time, you didn't need any type of postgraduate work either. I think in Virginia you still don't need that, but a lot of the states are starting to require a AGD, Advanced General Dentistry, or GPR of some sort.
Interesting.
But I didn't need that at the time.
You know, I've noticed that though, irrespective, there's a shift in that sort of mindset where when you talk to younger associates, new dentists, they're a little bit afraid to
Yes.
get behind the chair and get hands on.
Yeah.
Have you noticed that with your hiring plans and when you sit down and you evaluate candidates for your practice?
Yes.
Yeah.
Yeah. A lot of people don't feel real comfortable working on a patient by themselves. I'm not sure I'm not sure why that's coming about. I don't know if it's because, forgive me, but the litigious society that we live in,
100%.
so they're a little bit of afraid. Um, it's sad, I think. I think it's very sad. You go through all that training and supervision and school, and you get out and you don't feel comfortable doing what you've been trained to do.
Yeah. Well, you know, some people argue schooling doesn't properly provide those tools and skills. It just gives you kind of a conceptual, here's what you should know. And then when you graduate, it's a different concept because you have to apply those skills and you have to apply it in real time. And you have people, you have different element that you have to assess. It's not just like, for instance, when I went to law school, we would do moot court, but it wasn't the same as when you're actually in court practicing in front of a judge who's staring at you, exhausted, and has no patience for any mistake that you have to make. It's all novice and silly. So presumably maybe that's the reason.
So it's always been said, even when I graduated and when I first came out and I joined the practice, and my father looked at me and he goes, "You think you know a lot more than you do."
That's true too.
Okay.
Yes.
You are now trainable, right? You know how have enough skills for me to train you to actually do how to do dentistry at this point. And so I think that's the same thing. Maybe I had the advantage that I had my father, so I felt comfortable with him, and he was very good.
Mm-hmm.
He allowed me to, when I had something that I didn't know or I needed help with, came right over, would help. Sorry, just thinking of my father. He passed in August, so.
It was recent. I'm sorry.
But he was very good, very good. So.
Oh.
Yeah.
Well, let's talk a little bit about a phenomenon. It's not even a phenomenon, but let's make it attractive and fun.
Okay.
Corporate dentistry.
Okay. Yeah.
I'm
Yeah.
noticing a
That'll
big.
make me cry too.
Oh no, please don't. I'm noticing a big shift for a lot of these younger associates who are graduating. They're gravitating towards corporate. And I'm wondering, because often they'll come to me and say, "Can you help me review this contract?" And we look at these contracts, and you've seen them. I mean, they're really not paying what would presumably be a good starting pay. And it's very aggressive in terms of the hours needed and, you know, the collections expected. It puts a lot of pressure on someone who's just learning.
Sure.
And the thought, too, though, behind that is, well, it gives me benefits and it still gives me something to start off of.
Right.
What are your thoughts on corporate dentistry if you're a younger associate looking to kind of break through? Is that a good starting point?
So, when you get out, and it's a little tough for me in that respect because that wasn't very prevalent when I was starting out. It was basically non-existent. And in the last, that whole corporate medicine started it all. And now that they've decimated medicine, dentistry is the next, big money-making thing. And you got to remember and I don't begrudge them. I mean, the whole thing about corporations is to make money.
Right.
And to make as much money as you can. That's the whole purpose of it. And so when you get out, if you don't have a mentor, what are you going to do?
Exactly.
So that's, and because, the vast majority of practices now, especially in city areas, are going corporate.
They are.
Because we can't compete with them. For one thing, as a private practitioner owning my own business, it's difficult because of just the numbers, and we can't negotiate with insurance companies. Insurance companies won't negotiate with us. So they'll negotiate with the corporations because they can control a certain number of their patients. So I don't know if they have a choice coming out. You kind of got to get your foot in the door. I feel bad for them, with that. Um, yeah, it's the environment that we're heading towards, where I think, medicine is corporate, dentistry is going to be corporate.
It's all
I don't think
profit.
I don't think we can stop the train.
Yeah.
The train has left the station and it's going. So.
Well, but conversely, if you're a practice owner,
Hmm.
do you think there is a attractiveness to selling to corporate? And within that sort of thought process, because I'm going to say, yeah, it seems attractive because I've seen the offers, but what are some areas to really look for? And let's really explore that. So you'll get an offer letter, right? As somebody who owns an office.
Okay.
You're what? Usually in your 40s or 50s, if you have a very good, strong producing practice, you still have years that you want to work. Conversely, I've seen people in their 60s to young 60s. They try not to target an older age group that's truly retiring because they don't want you to retire. They want you to stay.
Yes.
Yes.
Right.
So they'll give you an offer and presumably it'll look attractive. Why? Because they make it nice and fluffy, as I call it. They'll give you a certain amount at closing. They'll give you a certain amount based on your earnouts, so essentially to run your business. They might give you some equity on top of that. And between all of these, they'll say, look, we're going to pay you 6 times EBITDA or whatever the multiple is, right? The
Right.
attractive multiple.
Right.
And so once you
That's the
sign
carrot.
that's the carrot.
That's the carrot.
Once you sign on, what happens then?
So, my experience, the first 3 months were fantastic. I mean, it was everything they said it would be. I didn't have the headache of running the practice anymore. I didn't have to. It was the first time one of my employees came to me and said, "This is broken." And I looked at him and I said, "You know what number to call."
Oh,
It was great.
yeah.
I mean, it really was. After, 30 years of running the practice and having to do that, that was a lot of relief. I had a lot of things going on too that were taking time away, so it helped. Now, where it started to go south was when it was very mismanaged, and so when the private equity that was backing started to pull back, the money started drying up. And when the money starts to dry up, they still have expenses. So where's the money going to come from?
Right.
It's got to come from the practices.
That's right.
Right? And if it's coming from the practices, who are the first people that are going to lose the money? It's the one who's giving up a portion of their income anyway, which is the dentist, because they have contracts with the employees. And we can get to that. They can only affect them so much. They did, and they can, but they can only affect them so much. So in my experience, if you're a practice owner and you're ready to do something like that, because the 6 times EBITDA
Right.
is very, very attractive, you got to be ready to, at that point, to walk away if you have to.
Right. Get your money up front.
Up front.
That's right.
Absolutely.
We say,
And you, let me tell you, if you need somebody, call Natasha because you gave me all kinds of warnings. You did. But because of what was going on with my personal life, I felt pressure to get the deal done.
well, what is your advice for people who are currently in business? I mean, most people in business, a good thing to do is think about your transition plan, whether it's 10 years from now, 20 years from now. How do you think, you now being, again, a practice owner after buying back your practice, how do you keep up with corporate? How do you compete against corporate?
Oh, listen, that's the $1 million question right there. How do you do that? You got to try to keep your overhead low. You have to give service. That's what you have that the corporations don't have, because it's hard for a person who doesn't feel like they're being compensated fairly to have compassion for the patient. You're a number, all right? I got to get you in. I got to get you in. I got to get it done. I got to get it done quickly so that I can move on to the next patient. All right? As a practice owner, we develop a relationship. You're not just my patient. We have a relationship. I have patients that have actually been in that practice longer than I've been in that practice. And it's neat. It's very, very neat. You can't get that with corporate.
We were talking about it before the podcast, how you always have to put on a fresh, happy face with each patient.
Yes.
And understand that, they're not necessarily happy to see you. I experience it.
Yes.
The shaky voice, I need a lawyer. It's like, oh my gosh,
Yes.
God forbid. But I totally understand that, except that, and I think this is what I really liked about what you said. It's about understanding that patient's perspective and saying, well, what do you want? I'm not trying to sell you on anything. I'm not interested in making you feel like you need more than you do. My experience with the DSO as a patient, and I didn't realize it was corporate, was I went in there and I felt like a conveyor belt, like they were just processing. There was no interaction with the doctor, very cold, quick, next. Whereas as a private practice patient, it's totally different. And in fact, my doctor will tell me, listen, you could do XYZ, but I think right now, let's just monitor. You're fine.
Yes.
And that's where, when you and I were talking, it seems like that's what you do as well.
Absolutely.
So how do you present a patient their plan? Like, tell me a little bit about how you offer your services to your patient.
It's interesting that you use the word sell, because you can actually go as a dentist and they will have a full day lecture on how to sell dentistry. Full day lecture on how to sell dentistry. I think it is probably one of the most abhorrent things that I have ever seen. I've been to a couple of them. And my thought is that if I have to sell you something, that means you don't need it, right? If I have to convince you that this is what you want, then it's something that you don't necessarily need. In my opinion, I have to present to you what your options are so that you can decide what is best for you. I can't decide what is best for you. The whole monetary thing is out of my control as far as what you have. So one of my best referrals are other dentists. When people come in with these treatment plans that are, pages long, that are tens of thousands of dollars, and I look at the patient and I go, you don't need it. If you want it, that's fine, but you don't necessarily need that. I got a patient for life there.
And they appreciate you.
Absolutely.
Yeah.
Listen, if I thought I needed something, someone told me that I needed something that was going to cost me $20,000, and I go to somebody else and they go, no, you're fine. Oh, very appreciative.
Well, aside from the cost, there is a pain factor. It's
Sure.
not pleasant,
Sure.
right?
Oh,
It's
absolutely. Wait a minute. All my dentistry is very pleasant.
Oh, of course. No, I'm sure.
No, you're right. It's uncomfortable. Listen, you're in a very small space. You're laying, you're prone, you're in a very vulnerable position.
Exactly.
Someone's leaning over top of you, with the, vibrations and noises and stuff like that. Yeah, no, I get it.
It's the equipment.
Yeah, yeah.
The equipment's intimidating.
Right.
But, that's the nice part, is when you're not trying to sell someone and you're guiding them through it. Hey, next, this is what I'm going to do. Don't be afraid. That helps prepare a patient. That makes
Yes.
them appreciate you and say, wow, they know what they're doing.
Yes.
I'm in good hands.
And if you're selling and the person doesn't do it, I would think that's almost a failure. You would feel that's a failure on your part, convincing the patient they need something. If I present a treatment plan and I tell them good, bad, and ugly, because there's no typically perfect treatment. Each one has advantages and disadvantages. If I give them that and they decide to do A over B that's their decision. And at least I gave them enough information for them to be able to make a decision that they're comfortable with. And if you're comfortable with it, I'm comfortable with it.
That's great.
And to that end, people say, well, are you sure you can do that? And I go, well, if I don't think we could do it, I wouldn't have presented it to you.
Yeah.
I don't give you that option if I don't think it's possible.
Yeah. And I think that's a good tip for associates who are starting their journey, is this pressure to sell versus this idea of building trust.
Right.
That, I would argue, is more important because ultimately, if somebody trusts you, they're going to trust in your recommendation.
Yes,
Yeah.
absolutely. But unfortunately, the environment in the corporate world doesn't give you that ability, because if you're not performing, they put pressure on you to perform.
That's very true.
And so you don't have that. It's interesting. My associate that's with me now, she's been with me for a couple years, and it's nice to see the way that she's grown. And because she started off with me in the corporate world, and there was a lot of pressure,
Yeah.
and she kept coming to me about the pressure. And when we went out on our own again, I said to her, I go, you got to do what's best for the patient, not what's best for your bottom line. It's what's best for the patient. And it's really, really nice to see her evolve in a very comfortable way of talking to the patient about what's best for the patient, not what is best for the bottom line.
Yeah, that's important.
It's nice to see. It makes me feel comfortable, and that's why we're still working together, because she doesn't have that need or feel the need to push stuff.
Yeah.
You know, I don't like patients feeling like they're pressured to do something.
I'm sure your patients love you for that.
I hope so. I hope so.
We should do a poll. Appreciate your dentist day.
That would be nice.
Bring gifts.
That would. I like gifts.
Of course. So, one quick question before we finish this podcast because of my voice. What is your thought in the ability to prolong generational dentistry? Do you think generational dentistry is dead, or do you think that you're still seeing a lot of the hand-me-down, so to speak? Dad was a dentist, son's a dentist, or daughter's a dentist. I'm seeing, at least in my position, that a lot of people, at least maybe this generation that's coming up, isn't so excited about dentistry, perhaps because of the financial pressures.
Well, so there was a Wall Street Journal article a few years back that said that there were 3 professions that were not worth going into because of the cost of getting there. Mm-hmm. And I'm, I'm not quoting directly. It's
Sure.
from what I remember.
Sure.
And I remember what the 3 professions were. It was chiropractic, veterinarian, and dentistry.
Really?
Those were the 3 professions that the Wall Street Journal recommended not going into because of the cost getting there. Students now coming out, it's not unusual for them to come out of dental school with $500,000 in debt.
Right.
$500,000 for education.
Yeah.
That's ridiculous. I mean, I don't even care if you come from a dental background, that's cost prohibitive for the family.
Yeah.
You know, even if your dad said, hey, listen, you go to dental, I'm going to, man, that's, $100,000 a year in tuition,
Yeah.
a lot of these places. Is that, are you capable of covering that with the income that you're going to earn from dentistry?
Yeah, that's a good point.
I don't know. I don't think so. So it makes it very, very difficult for generational dentistry now to occur, because and it makes it difficult because if the senior doc is thinking about retiring and using some of the income from the practice, how is your child going to come in with, if they had to take any loans out, and then pay you as well? I mean, I paid my father for the practice. I mean, that was one of the reasons that he could retire and work part-time. He started working part-time when he was 62.
Wow.
And when I mean part-time, it was 3 mornings a week. It was Tuesday, Wednesday, Thursday, 8 to noon, and he took a week off a month.
Wow.
Okay. And he did that for 10 years. I had to pay him for that's what kept him going, was that I was paying him for the practice.
Of course.
How can you do that with $500,000 in debt coming out of school?
But arguably, that's family money. So that's a little bit different than owing a bank.
Me paying my father.
Yeah.
Well, that's true, but the problem is it reduces my salary.
Sure.
I still have $500,000 in student loans that I have to pay off.
That's true.
10 years. right? I still got to buy a house or at least rent. I got food. Let's say I get married. I got a family, in that next 10 years. I mean, now kids getting out of school, young adults getting out of school, they're in their 30s,
That's right.
because they can't go straight through, all right? 30 years old, most of them have families. How do you crack that nut?
Well, you must love it then. And that's
I do.
the bottom line.
I do.
Gotta
The
love
dentistry
it.
I love. I
Yes.
love the dentistry. I love the people. The business aspects of it. That's why a lot of guys go corporate too.
Yes.
They get tired of the business aspect of it. Dealing with you're not partners with the insurance company. Even though you are a participating provider, there is no partnership whatsoever. It's them against you. And that can be tough.
But now you got your practice back.
I got my practice back. I have control. We can do what we want to do. We can offer a fantastic service for our patients, I feel, at the best reasonable cost that we can afford to give.
That's right.
Yeah.
And your patients love you for it.
I
You
hope
keep
so.
saying that.
I hope
Remember
so.
that. You're
Yes, ma'am.
loved. You're appreciated. There's a reason you're still here and you're smiling.
Ah,
And it's because of your patients.
Well, and listen, I owe you a debt of gratitude as well for all that you did for me. I couldn't have done it without you.
Well, I
Thank you very
appreciate
much.
you, doctor.
Thank you.
Well, thank you for coming today.
Thank you for having me. This was great.
Yeah.
It was just like sitting around having a cup of coffee and
We
talking
need
to a good
coffee
friend.
next time.
Absolutely. Absolutely. Thank you.
Thank you so much.
If you enjoyed today's episode, be sure to follow and share this podcast with a friend in dentistry. And if you're ready to take the next step in your own entrepreneurial journey, connect with me. I'd love to make your vision a reality. Until next time, keep building, keep growing, and keep practicing your passion.